So in this question here, a 23-year-old female just delivered a full-term male infant. Oh, you should first dry and stimulate him. We don't clamp the cord first. We want to make sure the baby's okay first. And quite frankly, um, there's some people out there, some physicians groups and others that are saying, let that cord blood go for a little bit. Like, get that immunity in there. There's no rush to cut the cord. And suctioning is out unless there's distress. So that what you would do is for a neonate, a newborn, they should dry and stimulate and warm them. They generally go together. You know, taking a towel, a soft towel, and trying to dry them a little bit and stimulating them while you're doing it. What you want to do is you want to make them mad. You want to make them cry and scream and see a crying pink baby. If by chance you don't, we'll go through some other questions about what to do, but generally you should make a decision in what type of care you're going to give. In uh, the first 30 seconds to a minute, you should be doing whatever resuscitation is necessary. This is a challenging question. I put this in, I'm a little bit of a pediatric bent. What I think is interesting about this question is that there's a lot of information, and you've heard me say earlier about what do you value, what's the most important part. I can teach a lot through this question. All right, so this kid is unresponsive and she's 10. Always pay attention to the age. Unresponsive 10-year-old different than unresponsive 30-year-old, which is different than unresponsive 70-year-old. Like, she passed out. She was acting confused before she collapsed. Skin is pale and moist. She localizes to painful stimuli. Pulse of 100, respiratory to 26, 114/72, standing at 98%. I'm not sure the smoking gun lies in the vitals here. All right, so she's unresponsive. So because of that, we can get rid of choice B. The definition of syncope is passing out and coming to very quickly, seconds often rather than minutes. Vasovagal syncope, for all intents and purposes, is fainting. Right? So let's see how this comes into play. So we're going to get rid of B, and let's see, opioid overdose. All right, confused, pale and moist. There's nothing about pupils, and her respiratory rate is 26. Yeah, that's not saying opioid overdose. That'd be slow. So I'm getting rid of C. So I'm thinking hypoglycemia and absent seizure. Right, first of all, she's unresponsive and she passed out. Right? She was confused and her skin is pale and moist. Why is her skin pale and moist? Because she's hypoglycemic. Remember, hypoglycemia is a sudden onset and often has moist skin with an altered mental status. And she fits all of these. An absent seizure, if we looked at this concept of absent seizure, the person, now, while it's a seizure that involves both cerebral hemispheres, it is still one where there's an altered level of responsiveness, but they're still responsive and apparently awake, but they're not there. Plus, the absent seizure wouldn't have cool, pale, moist skin. So the answer is hypoglycemia. And the question told us all this. The respiratory rate says that's not an opioid overdose. Statting at 98% says not an opioid overdose. But pale, moist skin, confusion, and a sudden onset has hypoglycemia written all over it. All right. Unresponsive 2-year-old female had a single seizure. Her father describes a single tonic-clonic type seizure that lasted 2 minutes. Tells you she hasn't woken up since the seizure. As you begin to assess her, she begins to have another generalized seizure. You should first. All right, so what she has is what's called status epilepticus because she's had two seizures without an intervening period of full consciousness in between. So if she's having a generalized seizure, we're not going to be able to insert an airway. Most of the time, the jaw is clenched. And it's very difficult to assess vital signs in a patient actively having a seizure, no less a 2-month-old. So now we have the choices between beginning transport and applying a cervical collar. I've never seen a cervical collar that small. They probably make them. If you have a spine thing, you can kind of always make one up. But here's the thing. Why would a 2-month-old need a cervical collar when they had a seizure? Because they can't walk or crawl. They couldn't have fallen because they're not doing anything, right? Not like they're out walking around and all of a sudden they have a seizure and then boom, they fall and we're worried about their spine. And even then, we don't worry about the spine like we used to anyway. So what do? You know what the beautiful part of 2 months old? There's no good part of a 2-month-old having a seizure. But do you know what the thing about this 2-year-old thing is? They are portable. You can pick them up and you can bring them out to the truck. So getting transport is a relatively easy thing because they are so portable. Now you want to have some way to get them in the ambulance and transport them safely, but you can pretty much get that baby and get them into the truck. Beginning transport is the correct answer.